Good afternoon. Welcome to Wednesday Reading Live. This is me, Vandana PS, joining you from 𝐻𝐂's Academy. Yes, another day. We have another new topic here. So as usual, I'll show you a sample question from part B. Then I'll give you 2 minutes for the same. So now let's look into the question first. So here comes the question. Yes, back with the question. So I'll read the question first, then we will discuss about part B. So what is the question here? The emergence of foster care is primarily due to. Okay, so first of all, it is very important to mark some keywords from the question. So what are the keywords from the question? Emergence, then primarily, due. So these are my keywords from the question. So what are the options mentioned? Option A, women were more likely to seek prenatal care. Option B, 50% of the babies entering the foster care are under age 3. And option C, 1/4 of the births belong to single females. So what are the keywords? From option A, I'm marking women more likely. Then from option B, 50% of the babies entering under 3. Then option C, 1/4 as well as single female. So these are my keywords from the options. Okay. So moving to the paragraph. Neglect and abuse of children in UK. The crisis of unplanned parenthood begins in the womb and women are less likely to seek prenatal care. So from the first line itself, we can eliminate option A because that is contradictory option or opposite option. So what is option A? Women are more likely to seek. No, they are less likely to seek prenatal care. In the UK, 80% of teenage pregnancies and 56% of all pregnancies are unplanned. The problems continue after birth, where unplanned pregnancies and unstable partnerships often go hand in hand. Since 1950, the number of single-parent families has nearly tripled. About 25% of all births today are unmarried mothers. So what is the correct answer? See? Okay, 25% of all births today are to unmarried mothers. So it is tracing towards option C, 1/4, which means 25%. As the number of single-parent families grows and more women enter the workforce, infants and toddlers are increasingly in the care of people other than their parents. In only 4 years from 1987 to 1991, the number of children in foster care increased by over 50%. Babies under the age of 1 are the fastest growing category of children entering foster care. The crisis affects children under the age of 3 more severely, the report says. So what is mentioned here? See, over 50%, which means in only 4 years from 1987 to 1991, the number of children in foster care increased by over 50%. Then, babies under the age of 1 are the fastest growing category of children entering foster care. So this 50% it is related to babies under the age of 1. So that you can eliminate which option? Option B can be eliminated again. It is contradictory or opposite option. So through elimination, we reached option C. What is option C? 1/4 of the births belong to single females. So instead of that, they have mentioned, paraphrased, okay? About 25% of all births today are to unmarried mothers. So that is the correct answer. Okay. So let me know how many of you got the correct answer. Okay, Reba, Sarala, Megha, Suganya, Abhi. Yes, good afternoon everyone. Maybe yes. So what are the correct answers? Yeah. Okay, Megha, option A eliminated. Very good. Abhi got the correct answer. Very good, dear. Megha, okay. Akila, C. Then Suganya, option C. Okay, Megha, eliminated option B. Very good. Saumya, okay, option C. So the correct answer is option C. Excellent. Yes. Hi, Reshma. Good afternoon. Okay, so that is all about the question. So now let's discuss about what is part B. Okay, how many questions are there in part B? As you know, we have 6 questions. Total number of questions should be 6. Then what about the type of questions? We can say multiple choice questions with 3 answer options. So either you can read the question first, then the options, and finally the extract of the paragraph, or you can read the question, then the paragraph, and you can move to the answer options. Okay, the strategy that we are using here, it's called elimination strategy or elimination method. So already I've shown you what is elimination method. So that's all about B. Okay, so now we are moving to the next part, which is as usual part A. Yes. So what do you know about part A? Okay, 6 questions. Yes. Hi Raji, good afternoon. Okay, Anisha, your answer is correct here. It is option C. Okay. Yes. Now tell me, what do you know about part A? How many questions? And what about the timing? About the category of questions and what strategy that we are using here. So first of all, let's talk about the time. Okay. So out of 60 minutes, you will take almost, exactly 15 minutes for the completion of part A. Okay, and what about the type of question? Total number of questions should be 20. So within this 15 minutes, we have to complete 20 questions. Okay, and what about the category? The question can be categorized into 3, 1 to 7. Those can be called match the following questions. Then 8 to 14, which can be called short answer questions. And the rest of the questions, which are 15 to 20, it is fill in the blanks. All right. Okay, then what strategy that we are using here? So we are using the strategy called skimming and scanning. Okay, Sony, very good. 20 questions and 15 minutes. Yes, dear. So what about the strategy? Okay, Suganya, 20 questions within 15 minutes. Yes, Megha, 20 questions. Yes. Okay, Megha, 15 minutes. Yes. Okay, Riba, skimming and scanning. So what do you mean by skimming and scanning, Megha? Any idea? What is skimming and scanning? The strategy can be called skimming and scanning. Yes, yes, Reshma, very good. So what do you know about skimming and scanning, or what is skimming and scanning? What is skimming and what is scanning? Yes, so skimming, which means fast reading, or you can say speed reading. So whereas scanning, which means we are searching for some important words from each of the text. So as you know, we have 4 different texts in part A. So these 4 texts will be entirely different from one another. Okay, and one of the texts will be a pictorial of something, maybe a chart or diagram. Yes. So coming back to skimming and scanning. So skimming, which means fast reading or speed reading, whereas scanning, which means we are searching for, or we are collecting some important words from each of the texts. Okay, yes. So what are the important words that you can mark while reading each of the texts? What are the important words, or what are the keywords? Any idea? What are the keywords? So now let's read each and every part, then we will underline the keywords from each of the text. So the topic is all about 𝐵𝐿𝐿. Okay, so 𝐵𝐿𝐿, also known as open spina bifida. So I'm just marking the condition. Then open spina bifida, is a congenital condition or birth defects in which your child's backbone or spine and spinal canal do not close before birth. It is a type of neural tube defect. Then 𝐵𝐿𝐿 develops in a fetus during the first 4 weeks of pregnancy. 𝐵𝐿𝐿 is characterized by incomplete neural tube closure and a fluid-filled sac that protrudes from your baby's back. The sac contains part of their spinal cord, then meninges, tissues covering their spinal cord, nerves, cerebrospinal fluid or CSF, and meningomyocele can happen anywhere along your baby's spinal cord. It most commonly occurs in their low back or lumbar and sacral areas. And 𝐵𝐿𝐿 is the most common central nervous system congenital condition occurring in approximately 1,645 births every year in the United States. So these are my keywords from text A. Then what about text B? It's all about the diagnosis. Then we have a lot of other points mentioned here. Blood test. So your healthcare provider will order a screening test that measures the amount of alpha fetoprotein or AFP in your blood during the 16th to 18th week of pregnancy. The amount is higher than normal in about 75 to 80% of pregnant people who are carrying a fetus with spina bifida. Then fetal or prenatal ultrasound. An ultrasound during pregnancy is the most accurate method to diagnose 𝐵𝐿𝐿. Healthcare providers typically recommend ultrasounds during the first trimester, 11 to 14 weeks of pregnancy, and second trimester, 18 to 28 weeks of pregnancy. Healthcare providers can accurately diagnose 𝐵𝐿𝐿 during the second trimester ultrasound scan. Then amniocentesis. If the fetal ultrasound confirms the diagnosis of 𝐵𝐿𝐿, your healthcare provider may recommend getting amniocentesis to rule out genetic diseases that are associated through, though rarely, with 𝐵𝐿𝐿. So these are my keywords from text B. Okay. And what about text C? Risk factors. So what are the risk factors? Folate or folic acid deficiency. Folate, the natural form of vitamin B9, is the important for healthy fetal development. A folate deficiency increases the risk of spina bifida and other neural tube defects, NTDs. Family history of neural tube defects, which are people who have had one child with a neural tube defect, have a 3% increased risk of having a second child with the same defect. In addition, people assigned female at birth AF-AB who were born with an NTD have a greater chance of giving birth to child with 𝐵 than someone who doesn't have an NTD. However, most babies with 𝐵 are born to parents with non-family history of the condition. Then anti-seizure medications. Some anti-seizure medications are linked to a higher risk of neural tube defects when taken during pregnancy. Then diabetes. People with poorly managed diabetes who are pregnant have a higher risk of having a baby with 𝐵. Then obesity. So that is all about the risk factors. Then we have a pictorial in text D. So I'm just marking the numbers as well as the signs and symbols. So in the brackets, N, that is equal to 22. Then neural tube, okay, neurosurgeon, name of that expert. Then 7 centimeter square. Okay, then margins cannot be approximated without any tension. Flap coverage. Then again 7 centimeter square. Then what else? Okay. Triple rotation flap cover, repair by Limburg flap cover as well as rhomboid. Okay, so these are my keywords from the pictorial. Alright, so now moving to the first question from match the following. So decide which text, whether it is A, B, C or D. The first, the information comes from, you may use any letter more than once. So the first question. So before that, let me know what are the keywords from the question. What are the keywords? Okay, a lot of answers here, yeah. Okay, mega particular or keyword scanning, okay. Yes, then 13 bullet points, yeah. What are the 13? No, 13 bullet points, okay. 13 keywords. Okay, mega, heading and subheading. Then, okay, Jansi. Yes. Okay, so first question. Okay, so what are the keywords? Heading, subheading, numbers, signs and symbols, names, then brackets, then what else? Abbreviations, italicized or bold words, then the names that indicate time, the names that indicate research, the names that indicate experiment, first and last line of each and every paragraphs, as well as all the bullet points. Okay. So now first question. The intake of which medication during pregnancy can lead to neural tube defects? So my keywords, intake, medication, as well as neural tube defects. Okay, so as you know, the medication which is mentioned in which texts? It's all about text C. Okay, see, anti-seizure medications, some anti-seizure medications are linked to. So that is from text C. So our answer should be C. Second one. When can a patient go after flap coverage? Okay, so where they have mentioned about flap coverage, my keywords flap cover. Okay, so that is from text D. As you know, it's all about flap coverage. Okay, so that is from text D. Then third one, the link between body size and 𝐵. Any idea? Third question? Yes, Sony, that was from diagram. Yes. Third one, link between body size and the condition. So which means it can be connected with the risk factor obesity. Okay, so that is from text C. So which is from text C. And the next one, when does 𝐵 possibly develop a fetus? So possibly develop in a fetus. So my keywords possibly develop fetus. So the answer should be from text A. See the second para. 𝐵 develops in a fetus during the first 4 weeks of pregnancy. So that is from text A. So our answer should be A. Fifth one. How do we manage the rhomboid shape resulting from 𝐵? So my keywords rhomboid and shape. So where this particular term mentioned rhomboid, so that is from text D, as you can see here. See, defect shape rhomboid. Already I've marked that keyword, so it was easy for me to identify in which text. So that answer should be text D. Sixth one, what is the purpose of conducting amniocentesis? So my keywords purpose, conducting, and the particular condition. So which is from text B, as you can see here, the last point, aminosynthesis. So my answer should be from text B. Okay, and the final one, the area that mostly affected by 𝐵𝐿𝐵 is dash. So the area mostly affected. So that answer should be from text A. See, where is the area? It mostly or it most commonly occurs in their low back. Okay, so that should be the answer, which is from text A. It is from text A. So these are the answers. Any doubts regarding any of the questions? Okay, Reba, yes. Reba, fourth one, yes, text A. Sixth one is actually text B. Okay, yes. Then eighth one. Which surgical intervention should be followed if the mean defect size is less than or equal to 7 centimeter square? So, as you know, that particular term is mentioned only in text D, right? It is only mentioned in text D. So, where is it mentioned? Yes. So, what is the correct answer? Okay, it's all about, any idea? Eighth one, which surgical intervention should be followed if the mean defect size is less than or equal to 7 centimeter square? Any idea? Okay, so that is from text D. Answer should be yes, direct repair. So where is it mentioned? Direct repair. It is from text D. Answer should be direct. Okay, Megha, third question from match the following, right? Okay, so what is the third question here? The link between body size and 𝐵𝐿𝐵. See, body size, which means it's all about the obesity they are talking about. So that is only mentioned in which text? It is mentioned in text C. Okay, it is a risk factor. So that is all about which is in text C. Okay, so coming back to the eighth question. So answer should be direct repair from text D. Okay, the ninth one. Who are assigned to? So we need who? Assigned to repair the neural tube and duration matter of the patients with 𝐵𝐿𝐵. So again, the particular terms neural tube and duration matter, which is only mentioned in text D. So what is the correct answer? Who are? It is neurosurgeon. Repairs of the neural tube and dura matter were performed by the neurosurgeon. So answer should be neurosurgeon from text D. Then 10th one. What is the approximate number of cases of 𝐵𝐿𝐵 per year in USA? What is the appropriate number? So we need a number. So that is from text A. As you can see here, the last paragraph. 𝐵𝐿𝐵 is the most common central nervous system congenital condition occurring in approximately 1645 births. So answer should be 1645. Okay, so now the 11th one. The elevated amount, the increased amount of which component in the blood confirms the presence of spina bifida? So my keywords, elevated amount as well as spina bifida. So answer is from text B. What is mentioned here? Your healthcare provider will order a screening test that measures the amount of alpha fetoprotein or AFP in your blood during the 16th to 18th week of pregnancy. That the amount is higher than normal in about 75% to 85% of pregnant people. So that answer should be from text B. Answer is alpha fetoprotein, or you can write AFP because that abbreviation is already mentioned in the question. Okay, then the 12th one. The improper management of which disease condition could increase the chance of 𝐵𝐿𝐵? Okay, so which disease condition? That is the question. So improper management. Okay, so answer is one of the risk factor, right? Of course. See, people with poorly managed diabetes who are pregnant have a high risk of or higher risk of having a baby with 𝐵𝐿𝐵. So answer should be diabetes. Then 13th one, in which trimester the providers can have the precise diagnosis of myelomeningocele. So which trimester? So we need which trimester. So which trimester? Answer should be from, again, text B. See, healthcare providers typically recommend ultrasounds during the first trimester and second trimester to 18 to 28 week of pregnancy. Okay, healthcare providers can accurately diagnose myelomeningocele during the second trimester ultrasound scan. So which trimester? Answer should be second. Trimester is already mentioned in the question, so you don't have to write it again. Answer should be second. Clear? Okay, and so you don't have to write second trimester, answer is second. Okay, Megha, it should be second. Then the next one, the last one, 14th one. The natural form of vitamin B9 that is crucial for the healthy development of the fetus. So vitamin B9, crucial, which is important, then development. Okay, so what is the correct answer? It is mentioned in text C, as you can see here. See the first one. Okay. Yes, it's all about folate or folic acid. So folate, the natural form of vitamin B9, is important, vital for the healthy fetal development. So answer should be folate from text C. Clear? So that is all about that. Then the last set of question, which is 15 to 20, you can write it in a word or a short phrase, again maximum 3 words. So 15th one, some dash medications are linked to. So what medications? Okay, so it is from text C, anti-seizure medications, right? That is only medications. Anti-seizure medications we can use for or are linked to higher risk of for neural tube defects when taking during pregnancy. So answer should be anti-seizure. Then the 16th one, myelomeningocele is characterized by incomplete dash and a fluid filled sac that protrudes from your baby's back. So what is the missing word there? 16th one. Okay, which is from text A. So what is mentioned here? It's all about myelomeningocele is characterized by incomplete neural tube closure. So answer should be neural tube closure. Yes, dear. Your answer is correct. Okay, very good. Then the next one.